Today we will discuss some of the questions which were not taken in the Instagram live. I hope people have seen the questions before I start answering them. So if at all you feel that your question was not answered, you can always write and then I'll answer the question. Now there is a remedy. If there are no questions, I will start basically talking first in relation to some case or some patient or some remedy. Before I get the question, I'll start answering the questions also. First of all, a question to you all. Normally I used to come live at about 3 o'clock, but now I started coming at 2:30. So what is the convenient time? You also can write that also, because there were a lot of queries. Okay, sir, do at 3 o'clock and do at 2:30. So according to that, we can plan that. Yeah, welcome Shweta. Shweta, welcome Dr. Disha. Good afternoon. So today I'll discuss a very interesting remedy. Good afternoon. Sometimes there are cases and there are remedies where you find very surprising that, oh, this remedy which I have studied and I have been made to understand these are the symptoms of this remedy, and suddenly maybe I am a doctor and I am telling you something very opposite to that, and you feel confused whether who is right and who is wrong. In homeopathy, remember one thing, that whenever you are doing studying a remedy, whatever it has been told to us by the doctors on the first, second, third instance becomes your soric understanding of that remedy. And whenever the patient comes to us, we always think of that what we have been taught, and then we try to apply that in the case taking and basically apply that in the patient. Today, for example, first I'll take a question. Welcome, Dr. Babel, Dr. Vishaka, Nitin, sir. Which potency you prescribe for acute phase on the chronic case, high or low? I start with low potency most of the time, 30 potency. Importance is which symptom you have taken for prescription. That is more important. So today I'll take a case where the patient was very untidy. The patient was very untidy, did not care about the clothing, did not care about the whereabouts, did not care about how the table was done or what he was doing XYZ. And when the patient is untidy, we have remedies, we have preconceived notions of some remedies. And the first remedy when we feel that the patient is untidy is, of course, sulfur. It is not only sulfur who is dirty and untidy. We have remedies like sorinum. Surprising, we have remedies like aurum ars. That is also untidy. Now there was a very peculiar, of course, when I prescribed the remedy, it did not work and the patient was only partially better. At one point of time, the mother also came in the clinic and we were discussing and all, and the mother said that now, see sir, his birthday is coming, and whenever his birthday comes, though he may be very untidy every time, but whenever his birthday comes and he knows that my friends are going to come, his room will be spick and span. He will clean the room, he will vacuum the room, he will take out all the garbage, all the rubbish from the room. Our entry point of the house, where we keep our sandals and slippers, will be all kept very neatly arranged in a proper manner. The walkway in our house would always be clean. He will water the plants, and till this room, everything would be spick and span. That was a very interesting symptom, I found, and I was looking at the Mater Medica, because normally I study every time the Mater Medica if it is not getting, the patient is not getting better. So every day you have to read at least one drug. Don't mug up the drugs. Don't try to remember the symptom of the drug that I know this is. Just keep on reading it. So whenever a patient comes to you and you feel, oh, this I have understood, I have read somewhere, you will get that remedy automatically. So this is a very important symptom. If you understand its symptoms, you will get a remedy which you have never thought of. So I took the rubric untidy except in what he is performing. Untidy except for what he is performing. Which is the remedy? The only remedy in that rubric is carcinosin. The only remedy in the rubric is carcinosin. Okay, so I'll just come to that question, doctor, and then I'll. So the remedy is carcinosin, and carcinosin, what I was taught, and maybe what you have taught is a very spick and span remedy, fastidious, very precocious, has an early responsibility, is sensitive to art, sensitive to literature, sensitive to the environment. We have been taught that way. So this remedy, what we have taught, and the negative part of the remedy is also very, very important. You will find carcinosin patient, carcinosin child wants lot of things. If he wants lot of things, if you go to buy a shirt, he'll buy two shirts. If you want to buy him, he'll go to a shop where there's a scheme going on. In two, three are free. He'll go there because the carcinosin child is always discontented. Remember this, my discontented carcinosin child. So, and a lot of times, carcinosin you feel is precocious. It is precocious, but he is forgetful also. So if the patient is forgetful for daily things, taking his handkerchief, taking his pen, taking his wallet, taking the mobile, and then going to the office or going to for workplace, he may forget daily things. That is also carcinosin. Are you with me? Third thing, if a carcinosin child is sitting in your chamber, he'll have two or three things very, very peculiar. I am talking the other part of carcinosin, which you don't know, which I did not know, so I'm sharing it with you. Biting the fingertips, that is also carcinosin, my dear friends. Biting the fingertips is a very, very peculiar symptom of carcinosin. And one more symptom you must have seen lots in your practice, but you have never been able to convert that into the symptom form. As I told you in my Instagram live also, in homeopathy, everything is symptom, everything is rubric if you want to convert into a rubric and symptom form. But again, the gravity of the symptom, if it is affecting the patient's personality and causing the disease process, that symptom has to be taken for prescription. Is that clear? That is important, my dear friends. So, tapping the finger on the scalp like this is also carcinosin. This is also carcinosin, my dear friends. So just remember these 3 or 4 symptoms of carcinosin, which I have found in many of cases, apart from what we have learned of carcinosin: precocious personality, responsibilities early in life, sensitive to environment, sensitive to music. These are normal symptoms of carcinosin which we have taken. So I'll just take one question first. 24 years, amenorrhea, leucorrhea instead of menses, first day spotting on blood, HB is 8.8, TSH normal on totality pulsatilla given plus sinusio Q, no change till 2 days, should wait or change the remedy? So if you are very sure that the remedy is pulsatilla, there's no need to change the remedy. In this case, we will require a lot of repetition. So my dear friends, start with pulsatilla LM potency. A sinusio Q, I'll not be able to answer this question because I don't give sinusio Q. Sinusio basically is a remedy for physiological amenorrhea. If it is there, then you can give sinusio Q. I cannot tell you on that. But pulsatilla, if it is right, give LM potency, it will work. You should waste. Yeah, carcinosin is a perfection, but today I have told you something very different about carcinosin. Did you understand, my dear friends? Are you with me? Did you understand something, or did you get something more of carcinosin? That is important for me, because if I am doing live twice in a week, I want you to understand, and you should increase your knowledge of Mater Medica with me, so that you know the other side of Mater Medica, other side of the remedy also, which you have studied, is the perfectionist plant. It is like a bonsai plant. The plant grows, you cut it, it becomes normal. The plant grows, you cut it, it becomes normal. So carcinosin basically, cut means he is not able to express his emotions, he is not able to express his desires, feelings, and it is cut because of some responsibility, because of dominance, and that's why carcinosin becomes like a bonsai plant, a good plant put on the showcase and it looks beautiful. That is carcinosin without any desires. That's carcinosin. Sir, which medicines are good for vocal cough? This question I've answered many of times. You can go to my previous live and see. Please explain negative side of carcinosin. I have told you, I have told you, my dear friend, the negative side. It is not the negative side of carcinosin. The negative side or the black spot in your personality will be shown in the form of the disease process. You're not at ease. So I cannot say it is the negative side of carcinosin, but normally as a perfectionist we see the good part of carcinosin. I am telling the part which I have seen, and sometimes I used to get surprised that I have not been taught carcinosin. So discontented children, biting the fingertips, forgetfulness for daily things, gestures, tapping the fingers are some of the symptoms which get into my mind of carcinosin, which I have seen in my practice and which I have seen and given in lot many of cases. There are other symptoms of carcinosin which are again very important. If I have no questions, I will basically tell that. That is a carcinosin. The negative side of carcinosin, is what? The patient has lot of confusion about trifles. You will be surprised. You ask carcinosin to do something, else say what to do, how to study, and you will feel once it has become bratacar. A bratacar, if you teach something, he is very difficult to be taught. He has to be 10 once, twice, thrice. The confusion of carcinosin, if you have read carcinosin in your Matermedica, read this symptom, confusion about trifles. The only drug is carcinosin. Are you with me? It cannot be the negative side. It is a side which we have not seen in our daily study of Matermedica. So for us, gaining knowledge is more important rather than telling you the same symptoms which you know. There is so much stress about the responsibility in carcinosin that the patient sometimes dreams also of responsibilities. Are you with me? Yeah. So different. Yeah. So my doctors are with me are writing different shades of carcinosin. Sir, any medicines for BHP, can it be cured by homeopathy? Now, Dr. Kamlesh, first of all, I would like to tell you that I have many of cases of benign hypertrophy of prostate. They are doing very well. I have treated, I have cured lots of cases of BHP, but not every case. I also have failures of BHP, and I have to tell the patient to go for allopathic treatment, and then they go for an operation also. But in my experience, it is curable, and if it is not working, I have seen if it is not working with homeopathy, even allopathic drugs are not working, then the patient has to go for an operation, because sometimes the size is so big, it does not work. Maybe my perception would not be good, but I have lots of cases where I have treated and cured BHP in my practice, so I can tell you it is curable. Of course, everything is not curable with homeopathy. Sir, 37 years, male suffering from varicose vein which are black and pain when touch of them, patient craving for cold climate, sir. Yeah. So remember one thing, my dear friend, if you are treating varicose vein, and you have basically, if you have symptoms, first, basically try to understand what are the local syphilitic symptom if you get. In your case, the patient is showing some typical symptom of black discoloration of the veins. So this is a very, very important symptom of varicose vein. The discoloration is black and the discoloration is painful. Are you with me? So whenever you get these type of symptom, please give importance to that symptom also. Are you with me? So I have 3-4 remedies which are very, very important. Of course, Hemamalis, Calcarea are very, very common remedies, but also think about millifolium, zincum metallicum, lycopodium, causticum. Just a word of caution and treatment. I tell you, I had a case of a 70 to 75 years of a male suffering from varicose vein and also vertigo. In that case, I gave the remedy theosinamine, which is basically varicose vein in old age because of the hardness of the veins, and vertigo because of arteriosclerosis. So that case, theosinamine, I started the potency 0/1. It gave me very good results. The vertigo was treated, the varicose vein also was treated. I remember a case of a female, same age, where our hemoglobin was very less. I think it was 8.9 or 9.1. In that case, again, I prescribed the remedy Ginkgoba biloba. It is a very good remedy for circulatory disorders, especially where because of age relation, the circulation is less and the hemoglobin is less. So I gave the patient Ginkgoba biloba. So apart from the remedies which I have told you, these are the two remedies you must think about. Theosamine, especially old age, hardness of or arteriosclerosis. Or one more remedy which you should always remember, varicose vein during pregnancy. These type of cases will come to you. In that case, varicose vein during pregnancy, the remedy should be ferrum metallicum. Very, very important, my dear friends. Okay. And if a lady comes to you and the lady comes and tells you that varicose vein are very painful before menses. Of course, there are a lot of remedies, but there is one rare remedy which I have found very useful in my practice, and that is Aristolochia clematis. Aristolochia, Aristolochi, Aristolochia. Very, very important. I hope this answers your question, doctor. In a very short time, I tried to tell you the remedy. Of course, my doctors are also writing the remedy what I'm speaking. 27-year-old anxiety disorder, patient taking allopathy treatment for 7 months on history with symptom to consider before medicine present. How to approach the case? Simple as that, Doctor Sir. Whatever Hahnemann has told us, that whenever the patient comes to you for treatment, take out the disease symptom, and then what is left is the patient's symptom, the patient's mental symptom, the patient as a person symptom. Take out the symptom which are caused by the allopathy medications, and then try to prescribe. Sometimes it happens to my case also, it will happen to you also, that the patient is taking allopathy treatment for 20 years for depression, schizophrenia, bipolar, and the patient comes to us for treatment. What do? I basically give the patient placebo for about 15-20 days, give counseling, and let the patient come after 15-20 days. And then I try to take the case, taking out the symptoms, the toxic symptom of the remedy of the medicines given, and the common symptom of the disease, and then what is left behind, I prescribe. Of course, in this case, it is very difficult to find what is left behind, but non-verbal communication will help you in your prescription in these cases. I have cases of schizophrenia, bipolar, taking allopathy medicines for 20 years, 25 years. So in this case, the taste, smell, sleeping position, desire, aversion, skin textures, hair, habits, hobbies. So non-verbal communication will give you a good insight. Symptom asked by the associate, symptoms asked by the friend also would give you a better quality of the patient's personality. And gradually as you progress, you can get new symptoms. In this, just a word of caution, try to give the patient LM potency, because you will require a lot of repetitions in these cases. Okay, I hope this answers your question. I hope. Please let me reference book for bachelor remedies. Dr. Back's book for bachelor remedies is sufficient, I think, to start your practice. Body ache after delivery, during pain, anxiety. Body ache after delivery, maybe it is because of nutritional deficiency. First, look at that. You can basically give remedies, the body has just gone through a violent trauma. So if it is a cesarean section, if it is a vacuum delivery, or the painful delivery, so there is a lot of tear and there's a lot of mental trauma also. Then you have remedies like, you can give arnica, you have ignitia, you have natramur, you have lecithin, you have aminacetam, you have ashwagandha, a lot many of it. China also, there's a lot of bleeding and a lot of fluid loss. Okay. I hope this answers your. If your question is answered, you can always tell me, so that I know that this is over and I have to go to the next question. Pain outer side of ankle, burning and pricking type, aggravation at night and worked at mud in agri fields. Okay, nice question, Dr. Shiv. So, on the outer side of ankle, I would not basically go for this, this very selective modality. I would say working in fields, simple as that. You can think about belly spur, you can think about ruta, you can think about arnica, you can think about sulfur, you can think about nitramule, you can think about uh, Goltharia, salicylic acid, acute. Child with leucoderma spots given chamomilla 1 m cured, then again started to appear, given 10 m, disappeared, and again after 6 months it appeared. I would have no, don't give so many. Don't start your case. This is my suggestion. I always start with 30 potency, gradually increase your potency, and then you will feel that your remedy works better. So instead of going 10 m for a case of leucoderma, it's a one-sided disease, So if your remedy is right, just start LM potency. Don't go so high in leucoderma, it would suppress because it is partial simillimum and it would aggravate the complaints after you stop the medicine. So in leucoderma, follow the concept of Dr. Hahnemann, one-sided disease, and then go with that. In leucoderma, there are 2 or 3 things which I have seen very, very important. First of all, whether it is symmetrical, the color, the origin of this spot, and the symptom, local symptom, whether it's itching or not. In leucoderma, basically it is the destruction of the melanophore pigments. So understand what is that destructive pathology in the patient's mind which has caused leucoderma. Okay. Anxiety. Okay. Okay, my doctors are writing more than what I'm speaking sometimes. No, so I hope you understood, Dr. Shazia. I hope you got the answer. Some questions have been scrolled up, so I have missed those questions. If you can write it again, it will be better. So did you understand the leucoderma case, one-sided disease? You have to you have to approach the case that way only, and go very slowly in leucoderma. I had an interesting case of a segmental leucoderma, only leucoderma here, right-sided. Now the patient has been coming to me for the past 4 years, and I started with 30, then 200. I did not go to 1 m. I went to the LM potency. So she's getting, she's 60 to 70% better. So go very slow. We expect a very slow result in leucoderma. Of course, it is slow and high, depends on your selection also. So if you go gradually with low to high, it will be much better and give LM potency. So the part of aggravation has been taken care of. Okay. Yeah. Thank you so much. So I hope you understood this. There's one more question. Answer. You can keep asking questions. So for answering for me, it becomes my revision also. I have given sulfur ruta on outer side pain, no result. So now I want to give dalkamara. Okay. Now, if you have given if you've given remedies and the patient is not better, so I'll tell you few symptoms which you have to, which you have to basically look in this type of cases. Don't give at random dalkamara. Why? Ruta and sulfur basically are very common in this case. Now, if the patient is working in the farms, first of all, if you have read maternal medical, there could be irritation with कांटे को क्या बोलते हैं, with thorns, irritation with the sharp pebbles, irritation with the stones, irritation with the thorns of the plant, and that can cause injury. So that first remedy that comes to you in that case would be belly spurnosis. And when the patient is working in the farms, she has to bend down, come up. So in this case, the remedy should be recurrent change of position and recurrent, muscle problem and this. So you have to think about arnica better than ruta. Third, if you are not happy with your results, you have to think of one remedy which is again very, very important. The patient says that when I come home, I sit, I feel better. The remedy is bryonia. And one more remedy, when you're working in the field, it is a lot of dampness and there is pain in the bones rather than muscles. So because of dampness, because working in the fields may cause that. For dampness, you can think about dalkamar and natrum sulf, but if there is pain in the bones, think about Eupatorium perfulatum also. Are you with me? So symptomatic. If you understand why you have prescribed, you may fail today, but after maybe a few years that would become your experience, and with experience you can try to eliminate the remedies also, which I am doing it now after 30 years of practice. Okay. When she's soaked in water, it feel, yeah, so that's what. So if she's soaked in water and then causes stiffness, three remedies again come to my mind. First, of course, Dalkamar you can give. Caustica, again very very important, and Rustox also, my dear friend. These remedy would definitely give relief to the patient, give the patient LM potency. It will definitely work. In case of depression, where mind symptoms are more prominent, should we start with low potency or directly high potency? Simple question, simple answer. What Dr. Hahnemann has told us, if you get mental symptom, if you are prescribing on mental symptom, you can directly start with middle to high potency. Simple. Okay. Let us go further. So this now again, Dr. Saab, just I'll tell you one thing. Again, if it is which side of body more important, left side or right side, then again you can differentiate that part also in your prescription. Okay. Okay, nice questions, and keep on asking me fast so that my revision is also there. Sometimes when you are seeing the practitioner, you think that you know everything because your practice is very fine. But some questions, I also get fixed what to answer. Sometimes it becomes difficult for me also to answer. Just thank you, sir. Gave cortisone 31 dose for withdrawal of steroids in RA. Very nice, Dr. Disha. Very nice, Dr. Disha, and thank you so much for sharing your experience, because it is not that you learn, it is I also learn. Everybody apart from Hahnemann was a student of homeopathy. He is the boss. So thank you for your inputs, and I hope you cure arthritis, because it is a very deforming disease, and we cure a lot of diseases, but curing autoimmune disorders will give you a lot of confidence. Okay, so cortisone 30 has worked very nice. Still sugar is high and with tingling sensation in hand. You can wait. Like for instance, if I'm curing a case of cancer and the patient says the cancer is okay, I had a case of mouth cancer where the cancer is okay and the patient diabetes was high. So from syphilis the patient is going to psychosis. Wait, and just also Hahnemann has told something about diet and regime. So give the patient some good diet, give the patient a good auxiliary measure of treatment also. Automatically the patient will start getting better. Our medicines are, I can't say the word miraculous, but they are very good, but at least the body has to be disciplined. That's why you read Organ of Medicine what Hahnemann has told us about diet and regime also, and auxiliary treatment also, that will help the body to fight the disease better. Okay. Dr. Joshi, left side migraine started from occiput extending to the right eye, agonized forenoon, sunrise, fever, acidity, vomiting. Is it depression? Want to sit alone in corner of the room and weep? Okay. Now, same question. Had ischemic in the brain vessels. Okay. Now, a very interesting case, a very interesting question. Migraine followed by vomiting, same symptom, wants to sit in the corner of the room. Now, when you are basically suffering from depression, and you want understand why there is depression, I'll give you a basic answer. There are a lot of remedies which come to my mind. I'll give you all the remedies. You will then decide what depression is the patient suffering from. Sitting in the corner of the room, brooding and depression, write the remedies, my dear friend. Don't start with natramur. Bratacarb, bratiode. Your case is also suffering from what you call ischemic changes in the vessels. Bratiode, very important. And bratiode also has brooding, and the patient sits in the corner of the room. Cocculus indicus, belladonna, conium, veratrum, hyoscyamus. These 7 remedies that come to my mind. Don't always give natramur. So, are you with me? Bratiode, bratacarb, camphor, cocculus, conium, veratrum, hyoscyamus. You can also use other remedy. It may be there, but my memory is this only. I can remember those remedies only which you have told us. But in your case, it is a change in the cerebral vessels also. So you must think about that also. Rustox has since brought about repeated improvements. She can now walk but still falls to one side on back or on her back. Again Rustox, or do you have other remedy? I would suggest, if Rustox has given relief, then give Rustox in dilution, more dilution, so more the effect. Don't change the remedy unless you feel that the symptoms which are there are absolutely different from Rustox. In this case, I would suggest one remedy. If you give that remedy in between and then again let Rustox to work, it would work better. This is my experience of treating the cases. That remedy is conium. Give a diluted dose of conium, maybe, and then Rustox in diluted form, that is LM potency. Start with LM7 or LM8. That would give you better result. Okay. Which medicine works for increasing the cognitive function? All the remedies work for cognitive, depend upon the case taking, Dr. Nitin. I am not a good prescriber on specifics, so case taking would give me a better remedy. Thank you so much. Already half an hour up, and thank you for joining, and I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you again. Meet you on Instagram Live on Thursday. Thank you.